talk now. I'll give you the opportunity. Good. Okay.
Okay, so my topic is making sure that when you give people medication, that is not going to waste their time and money. So when we see a patient with hair loss, my strategy is nearly always the same. I start with medication. It's my first line of defense. And the most commonly used medication as an anti-allergenic is finasteride, whether it be topical or oral. In our practice, we prefer to use it topically because then patients are more prone to use it because they're always afraid of the side effects. But sometimes we see this. This is a patient that we saw for a transplant in the frontal area, and he had been using oral finasteride for 5 years. And this picture is from his transplant 1 year ago, and now we see him again for covering his crown area, and it actually became larger. So he was taking finasteride, and still he was balding. So what do we do then? Because we can tell him, yeah, keep on taking the finasteride, but it's obviously not working for him. So maybe you should change the medication, but what medication are we going to use? There's a lot of molecules currently on the market. Which one is the best? If you want to try them all, it's going to take a long time. So what we do is we use the Trico test by Fagron, and it's based on your DNA to see which molecules are proper for that patient. And I've been using it for a year almost now. And we use it for people we see that are obviously not responding to the finasteride or are responding but not really good responding, or for young patients, so we don't lose any time. And it gives us an idea on what formula is best for that patient. And so far we've done 125 patients, of which 49 were already using finasteride, and out of those 49, 30 were not responding to finasteride at all. Only 7 responded really well to finasteride. And then from those 125, which was the best, well, here it was dutasteride, but does that mean we should change our way of doing things and instead of prescribing finasteride, go to dutasteride? Well, no, because as you can see in the graph, the spironolactone was also quite popular. So how are we going to do this? Are we going to just keep on guessing and trying different molecules, or are we just going to take off the blindfold and go for the straight result? Because this is a result when we change the topical solution from finasteride. In this case, it was dutasteride, and you can tell that the hair really responds much better. So in our practice, we've decided if we start with medication, whether it be topical or oral, but as I said, we prefer oral, and our patients especially prefer topical, then we base it on a DNA test of Fagron. Thank you for your attention.
Nice. How much do you charge for the Trico test?
250 euros.
Oh, that's a good price.
Yeah.
So why don't you start with it?
What?
Why don't you begin with the test rather than wait?
Now we do it.
Now
As
you
I
do.
said, now we do. In the beginning, we didn't always do that. We started really because of we saw patients who were taking finasteride and didn't respond well. So then we were like, what are we going to try? Because you have to do it at least 3 to 6 months to see if they're responding, yes or no. So that's a long time, and patients are impatient. So that's why we started using the Fagron test. But in young patients especially, I tend to really encourage them to use the test first, just to make sure that we don't lose any hair.
Right. So my question would be, how accurate are the results? Like when you do it, like you could be like minimally responsive to finasteride and minimally responsive to dutasteride and responsive to spironolactone. So would you start your patient on dutasteride or finasteride, or would you move straight to what the green zone? You go straight there.
I always, unless it's latanoprost,
Yeah,
then I would consider using one that has a
which can be
slightly
very
less
expensive.
better response.
Latanoprost.
Because that's really, really expensive. So for me, if the anti-androgenic is really responsive,
Mm.
then I tend to not use the latanoprost.
Yeah.
Because it's
And if you can't sulfate minoxidil, you have no reason to
yeah.
give it. Great.